So the thinking is, how do we make astronauts really be autonomous for their own healthcare? And it's a similar problem on Earth. Like, how do we bring healthcare to people in remote regions that don't have experts and will never have an expert nearby? How do we put a specialist in their pocket? So I'm Art Papier. I'm the CEO of VisualDX, and I'm also an associate professor of medical informatics and dermatology at the University of Rochester in Rochester, New York. VisualDX is a company of 60 dedicated people and growing that's focused on software to improve healthcare decisions, both with professionals and with individuals in the home. So we develop applications that are used either on the desktop computer or smartphones that answer the essential questions of medicine, which is, what do I have? What's my diagnosis? What does the patient have? What are the diagnostic possibilities? What are the best tests? What are the treatments? How do I get people to understand what I have? And so VisualDX is really focused on this idea of augmenting the brain with tools. So merging information that is computer-based with good judgment and logical competence of the brain. And it's really an augmented intelligence philosophy. It's not man versus machine. It's not the computer replacing doctors. It's really about how do we develop information systems to improve thinking. So at VisualDX, we often use the airplane cockpit as the analogy. You know, you wouldn't ask a pilot to memorize every route in America and expect them to have it all in the brain. We have instruments in the cockpit to guide flight, to guide takeoff, to guide landing. And we're asking the question, what is the ideal cockpit for patients, for their health care? What's the ideal cockpit for the professional to think through their problems? And so in this work, we've realized that there's a tremendous need to bring health information to non-experts. There's supposedly a shortage of about 17 million healthcare workers globally. And we recognize that we have to drive information down to people who are not physicians, who might just be healthcare workers. And in this work, we came to realize that there was a need in space as well. I mean, astronauts could be on deep space flight away from this planet for 3 years, and the radio signals are not going to reach us in a timely way. I personally do not have a ticket to go to Mars, but I think it's incredible that we have people that are willing to take that risk in the nature of just exploration and getting out there to have humans just do the impossible.